Hello friends, I am Dr. Neelam Doshi, eye surgeon practicing in Ghatkopar East at Jyoti Multi-Speciality Clinic. In this video, I am going to explain how to choose an intraocular lens, that is IOL for cataract surgery. Before I explain you about IOLs, let me explain you what is cataract. Now, there is a natural lens inside the eye which is transparent like a glass that allows the light from the outer object to fall on the retina at a point focus so that the patient's vision is clear. Now, as this lens loses its transparency either because of advancing age or some pathological diseases of the eye or due to trauma, the lens becomes opaque. This opaque lens is called as cataract and it does not allow the light to enter into the eye and fall on the retina at a point focus. The light entering inside the eye gets scattered because of the cataract and that is why the patient's vision becomes blurred. Now what do we need to do about this cataract is to remove it surgically and an artificial lens is implanted in its place. The technique by which this procedure is done is called as phacoemulsification, wherein we use an ultrasound energy to break the cataract into small pieces, emulsify it, liquefy it, and then it is brought out of the eye using suction. And then an artificial intraocular lens is implanted in the eye. Now, when the doctor diagnoses cataract, he gives patients multiple options for intraocular lenses from which the patient has to decide which lens to put inside the eye depending on his visual needs, lifestyle and of course the cost of the surgery which fits into his budget. Now there are four types mainly of IOLs. One is monofocal, multifocal, EDOF and toric. What are monofocal lenses? Now monofocal means, as the name suggests, mono means single. When these lenses are implanted in the eye, only one distance will be corrected where the patient will not need glasses, either far distance or near distance. So most of the times patient's distance vision will be corrected with the monofocal lenses where the patient will not need glasses for viewing distant objects, but for reading and for near work patient will definitely need glasses. With the advent of newer surgical techniques and advancement of IOL designs, there are special types of lenses which are there in the market which will either completely eliminate the need of wearing glasses or dependency on the use of glasses will be reduced to a greater extent. Now these special lenses are multifocal IOLs, EDOF IOLs and toric IOLs. What are multifocal IOLs? Now as the name suggests, the multifocal IOLs will correct the vision at more than one distance. That is, these lenses are designed in such a way they have multiple rings on the surface. Now these rings have got powers in it. I mean the different powers are incorporated into these rings which gives range of vision from far, intermediate to near. Again, the multifocals are of two types, bifocal and trifocal. Bifocal lenses will correct the vision for far distance and for near, and trifocal, in addition to distance, far distance and near distance, the intermediate vision also will be corrected. That is, patients having computer work and the laptop or mobile usage will not need glasses for that distance also. The disadvantage of multifocal IOLs is that there will be a mild loss of contrast sensitivity, and also those patients who might experience little bit of glare and halos while night driving around the lights of the oncoming vehicles. The third type of lens is an EDOF lens, which is also called as extended depth of focus lenses. These IOLs are designed in such a way that they give corrected vision for far distance and intermediate distance, and to some extent the near vision also will be corrected. But very like those patients who want to read very fine fonts or doing a very fine work, the glasses might be required of a lesser number. The advantage of the EDOF lenses over multifocal is that the glare and halos which are there with the multifocal lens, they are overcome here with the EDOF lenses. Fourth type is toric lenses. These toric lenses are used for those patients who are having cylindrical power in their glasses, also called as astigmatism in their glasses. These IOLs are designed in such a way that their cylindrical power is eliminated. The toric lenses come in monofocal, multifocal and toric, the EDOF also. So this is all about intraocular lenses. I hope you find this video informative and it helped you understand the different types of IOLs, and it might help you in future to choose about the IOL, of course after consulting with your operating surgeon. Thank you.